Up next is Rachel Madley. She is a PhD student from New York City. She's active with SNAP and PNHP. Welcome, Rachel. Are you with us? I know this is a little earlier than you expected.
Yes, I'm here. Can you hear me?
Okay, great. Yeah. Okay, so, the coronavirus is this global pandemic. It's hit every kind of healthcare system there is in the world, and not all of them are responding in the same way. It's truly a test of a healthcare system and a political system. It takes both to respond. So, Rachel, from your vantage point there in New York City and your work with PNHP, how's the American healthcare system doing on this test?
So, from what we know now, the U.S. healthcare system is just not up to this challenge, and that's not the fault of the doctors and the health professionals that are on the front lines. It's because our system is incredibly fragmented, it's for-profit, and it's very cost-prohibitive. So since the U.S. does not have a universal healthcare system, we just don't have the infrastructure needed to support the universal medical need that's going to be seen in a pandemic situation, and the infrastructure that would support us being able to test and treat everyone. The default setting for the U.S. system is to ration care based on ability to pay, not to provide care to everyone. So in other countries with universal health care, and specifically single-payer health care, we're seeing that they are combating the virus much better than the U.S., and that's because in a single-payer system, there's no pressure to delay or skip care due to cost. But in the U.S., we likely have many people with coronavirus that are further spreading the virus because they're afraid to seek care because they're afraid of medical debt and bankruptcy that has become all too common in the system. And single payer would also eliminate the wasted time and money that are spent on insurance and billing tasks in the U.S. system. So right now, doctors spend about 48% of their time on admin tasks. So in a single payer system, if we decrease these wasteful tasks, we'd actually increase doctors' ability to treat patients, and that would increase the capacity of the medical system as a whole to combat a pandemic, which like the situation we're in. And many countries with single payer actually have higher numbers of hospital beds per capita than the U.S., whereas in the U.S., we actually have some hospitals that have more billing clerks than beds. So we have a huge misallocation of resources in the U.S. health system toward billing and not patient care. And if we had a single-payer system, we could reallocate those resources to better serve our patients in this huge pandemic situation. And so single-payer systems are also allowing for testing at much higher rates than in the U.S. And one big reason for that is in the U.S., there was mass confusion and chaos about who pays for the test, how do we bill for it when testing was first rolled out, which led to a lot of delays. And countries with single-payer healthcare have actually been able to leverage their universal electronic medical record databases to help them identify and track cases and allocate resources to the hardest-hit areas. The U.S. doesn't have this capability because our electronic medical records are siloed within different hospitals and insurance companies. So as the U.S. struggles to control the coronavirus with a fragmented response by thousands of different hospital systems and insurance companies, countries with single payer, like Taiwan and South Korea, we're seeing have actually been able to slow the spread and treat patients effectively with a unified response. And even in countries hard hit like Italy, which also has a single payer system, they're still outpacing the U.S. in their response by testing at much higher rates than the U.S., being able to cover all care for their people, and having more doctors and hospital beds per capita in the U.S. So in our opinion, the U.S. is failing this test, but we think we really need to learn from the cracks and gaps that this is exposing in our healthcare system and use it to make positive changes so that we're prepared the next time this happens. Because we believe that the situation demonstrates that a single-payer universal health system is a prerequisite for a successful pandemic response, but it's definitely not the only social program needed to support our people in this crisis.
Well, thank you, Rachel. And I just want to ask you one other question. Since you represent PNHP, healthcare workers are on the front lines of this crisis. Even just this morning, I received a recorded message from my county here in Cleveland asking people to donate protective gear and hand sanitizer and other supplies for hospitals. What can you tell us about how we all need to be mobilizing to help?
Yeah, so that's exactly right. Medical workers are not being adequately protected and desperately need more protective equipment. And in addition, hospitals also need a lot more beds, a lot more doctors and nurses and ventilators to be able to safely and effectively fight this coronavirus. So in the immediate term, health workers really need increased funding and production of these items. And in the long term, PNHP believes that we need to move to an expanded and improved Medicare for All system, which allows for increased expenditures on these items before a crisis happens through decreasing our admin and billing expenditures. And overall, the U.S. also needs massively increased spending on public health so that we're not caught off guard the next time we face a crisis like this, because pandemics are going to happen. We just need to be better prepared. So right now, what we're asking is people from all groups represented on this call to call your legislators and make these short-term asks to help our doctors and also our patients, but also make these long-term asks of increased funding for public health and Medicare for all. And we're also starting to participate in virtual advocacy, which I know a lot of people are talking about on the call today. So the New York Metro chapter that I'm a part of held a virtual day of action, and we think that this could be really helpful to get our message out about increasing protections for medical workers and single-payer healthcare for pandemics. And you can host interactive webinars. We did one where people just shared their healthcare stories and taught people how to write letters and op-eds. And you can also meet with your elected officials over the phone or online. It's new territory for all of us, but I think it's a really effective way to get our message out there. So thank you for having me on this call.